Cost-benefit analysis. How do you determine a program's value in monetary terms? How can you compare competing options such as to do or not to do, or to select Project A over Project B? Cost-benefit analysis offers one way to assess a project or program, making it easier to compare it to alternative options. Cost-benefit analysis is a method to compare the values of resources consumed, or costs, to the value of consequences, or benefits, in providing a program or project over a period of time. Value is best measured in monetary units. Value can be expressed in non-monetary terms, such as psychic value, but it's impossible to quantify those types of value. Cost-benefit analysis should be used to rank the social value of alternatives to a public policy decision, such as a proposed new road, a dam, bridge, park, or any new law or program. However, this formal assessment method is often not followed because those big decisions usually turn on political decisions, as in who has the votes and who has the power. Cost-benefit analysis can also be used to assess personal choices. A personal example may help identify the types of benefits and costs to consider. Let's take Bob. Bob will drink alcohol at his favorite bar if the benefits are greater than the costs. What are the benefits of this behavior? We might be able to list a few. Drinking changes his mental and emotional status. It promotes stress reduction and relaxation. It may ease physical and emotional pain. It instills confidence, and it offers possible taste satisfaction. But what are the costs of this behavior? A list of those might include drinking can cause weight gain. It may cause fatty liver and liver damage. It may cause poor sleep. It could evolve into alcoholism. His altered mental state could damage relationships with others, and it could cause derision by others for drinking too much. It may be hard to put a monetary value on each item, but this process offers a framework to look at the options, drinking versus not drinking. Bob can consider whether the benefits of drinking are greater than the costs. Of course, this remains a personal choice. A second personal choice is presented here. Let's say you wake up this morning with a terrible pain in your lower back. It's so bad that you can hardly straighten up. The choice then is, do you go to the doctor today, Monday, or wait until your annually scheduled appointment, which is on Saturday, which is also your day off? The factors that may drive the decision include the following items. You work Monday through Friday as a waiter for 8 hours a day at a rate of $10 per hour. Therefore, the cost of taking the day off to go to the doctor is $80, plus any tips. The cost of seeing a doctor without an appointment is $20 more than if you had waited until Saturday. There is value to reduced pain if the doctor prescribes pain medication or another alternative therapy, but it may be hard to put a monetary value on it. There is a productivity value of working more efficiently at your job for the remainder of the week if the pain is addressed. Perhaps you're paid for each table that you serve during an hour of work. If you're working at regular speed, you serve 15 tables an hour. But if you're in pain, your speed is at best 8 tables an hour. That drop of 7 tables not served, at say 1 monetary unit each, represents the loss of 7 monetary units of pay for that hour of work. Every hour of diminished ability to work simply compounds the loss of wages. There is value in having the doctor eliminate other, more serious reasons for your back pain, other than just a simple muscle spasm. There is a value in avoiding further damage to your back. And there's value in being able to continue your normal activities at home, such as caring for a child or an elderly parent. In summary, this example demonstrates ways to quantify some of the personal benefits and costs of a choice to do or not do something. We can now turn to a more complex choice, the decision to open a rural health clinic in a new area. The key in doing a cost-benefit analysis is to identify the choice facing the decision maker. In this example, the choice is for a clinic system to start a new rural clinic or for the clinic system to save the money it would take to do that. Given this dilemma, we have to list the benefits and costs of starting a new clinic. For each item listed, we would need to assign a monetary value. I suggest that a way to monetize each one is to do it for a single patient. That amount then could be aggregated up to the size of the group expected to be served. Beneficial impacts of locating a new clinic in the new area is that it would help prevent bad health conditions for a target group in that new area. So, as a hypothetical example, a clinic devoted to HIV testing, early detection, and treatment might offer an X% improvement in health outcomes. As an example, intervention now avoids future complications of other illness, and it prolongs life. All of this translates into Y savings in future wellness from disease management. Avoidable hospitalizations could be monetized as days of hospital savings at X price per hospital day saved over the patient's lifetime. A local clinic offers convenience and reduced travel time for clients served. Increased worker productivity is measured as time saved from being away from work, or in diminished work capacity based on hourly wages. Revenues collected refers to the fees that might be collected, or the revenue raised from government agencies or donors to cover the costs. Cost items may be easier to understand. There are patient costs and burdens. Even though a client saves time by not having to travel to a distant clinic, there's still time within the clinic waiting for and receiving service. So that's a patient cost. Opening a new clinic requires space. So either a facility will have to be built or rented. If it's built and owned by the clinic system, there will be maintenance costs going forward. There's an additional set of equipment that has to be purchased, and, depending upon its sophistication, a maintenance agreement for its upkeep and calibration. There are staffing costs for physicians, nurses, and administrative staff. Operational items would have to include direct costs such as supplies, materials, utilities, and staff travel for those at the new clinic. It should also include any indirect costs such as the supervision from the home office. If the new clinic imposes a fee for service, even if it's often waived, then there is an accounting and collection cost. These are just a quick listing of reasonable benefits and costs of starting a new rural clinic. A more serious study might find others and monetize them differently. Again, the goal would be to look at a project like this over a number of years. Now that you have seen a more realistic example of the costs and benefits of a project, we can step back and look at the basic process for doing a cost-benefit study. The basic process is to first identify the alternative choices, such as to start a new clinic or to save the money. Second, list the benefits and costs over the life of the project, as we just did in the last example. Third, translate all the costs and benefits to monetary values as we showed. Fourth, since a decision is made today with the costs and benefits flowing over several years, we have to discount benefits and costs to obtain the present value. Calculating present value is part of the time value of money that is covered in a separate course module. A key part of this fourth step is selecting the discount rate. In our clinic example, we said the alternative to opening a new rural clinic is to save the money instead. If idle funds could be invested at, say, 7% compounded over 5 years, then we could use that rate as our discount rate for the alternative to saving, which is starting a new clinic. Alternatively, we could use the clinic's borrowing rate. If, for example, our primary lender would charge the clinic 8% to borrow money for 5 years, then we could use 8% as the discount rate, since it would be an alternative use of our resources. As this shows, the choice of a discount rate is determined by reasoned judgment. The fifth step is to compare the sum of the present value of benefits to the sum of the present value of costs. By doing so, we can determine if the project or program under study meets economic efficiency criteria. There are two measures. First, net present value is where benefits exceed costs, so a positive monetary result is economically efficient. The second economic efficiency test is the benefit-cost ratio, or benefits divided by costs. Economic efficiency is when the result is greater than 1. The last step is to make a recommendation. Using our example, it would be either saving the money or starting a new clinic. Now we can return to the clinic example to see how it might look when doing cost-benefit analysis. The monetary units shown here are hypothetical values for the stream of costs and benefits over a 5-year time horizon. The year column is column A. Costs are shown in column B. The initial cost of $150 is for construction of the new clinic, with $80 by the end of the second year for the remaining construction and equipment costs. For the other years, the $75 represents recurring costs. For benefit column C, the step up represents an increase in the target population learning about and using the new clinic, and then it stabilizes. Column D refers to the present value calculation. As we stated in the prior slide on the basic process of cost-benefit analysis, we have to put all of these monetary units into a present value, since the decision is made now to either save the money or start work on a new clinic. We could either save the money and earn 7% compounded annually over 5 years, or we could invest in the new clinic. We can then use that 7% as the discount rate in our present value calculations. In column D, we show the present value interest factor for one monetary unit, abbreviated as PVIF. The formula is shown in the sidebar. Just as a reminder, this formula comes from the other class module on the time value of money. The basic formula is the future value of $1 divided by the product of 1 plus the discount rate, all raised to the power of the year in which that cash flow occurs. The values in column D show that there's more power for early money than later money. Later money is discounted more because it has less opportunity value. Column E is the product of multiplying costs times the present value interest factor. That means multiplying column B times column D. The results reveal that the 150 of costs now, year 0, need not be discounted since they go out now. The 462 sum of column E represents the sum of the present value of all costs. Column F is the product of multiplying benefits times the present value interest factor. That means multiplying column C times column D. Again, the results show that the 50 of costs in year 0 need not be discounted. The 432 sum of column F represents the sum of the present value of all benefits. All of those steps lead to the bottom line assessment. Does this project meet economic efficiency? As we define the two measures of economic efficiency on the prior slide, we see that at a 7% discount rate, this project fails both tests of economic efficiency. The net present value is a negative number, and the benefit-cost ratio is less than 1. These results would suggest that the alternative of saving the money and investing the money at 7% offers some advantages. But remember that many of the items listed as benefits and costs are not actually directly attributed to the clinic system. Instead, they refer to costs and benefits of the clients. Conceptually, then, the 7% refers not only to the savings by the clinic system, but the opportunity values of these those clients to use their time and resources differently. Perhaps the 7% rate is not the right rate. Sensitivity analysis means to use different percent rates to see what rate produces economic efficiency. In this example, no rate level will change the project's inefficiency. The only solution that works would be to reduce the first year's costs. We might just disregard this formal cost-benefit analysis and decide to go forward with the project anyhow. There could be a number of reasons to start the new project. It could be politics, the availability of donor money, or to advance the mission of our organization. In summary, cost-benefit analysis offers a systematic way to assess the value of projects or programs. In the end, however, a manager has to make a decision among hard competing choices that are more like comparing apples to oranges. They're very different.